Hello and welcome to Fast Tracking Scotland, our closing plenary for this conference. I'm delighted to be bringing to you an amazing panel of speakers for this closing plenary, although when I say closing plenary, it's not the last session of this conference, and please do make sure you tune in at 3:30 to our final optimising PrEP services session. In this session, we're going to be reflecting on the last 3 days of this summit and what we all need to do in order to meet our shared goal of zero new HIV transmission, zero HIV-related deaths, and most importantly, zero stigma and discrimination. On the panel this afternoon, I'll be delighted to introduce Dr. Nicoletta Polacek, who's the chair of HIV Scotland and works in academia. We've got Joe Fitzpatrick, MSP, who is the Minister for Public Health in the Scottish Government. Dr. Jose Zuniga, who's the President of the International Association of Providers of AIDS Care, IAPAC, who are the main collaborating partner for the Fast Track Cities initiative. And Dr. Lena Sathya, who's the HIV Medical Director for Gilead Sciences. Just a couple of points for you. We do have the Q&A function that we would like you to use during this session. Please do pose questions to our panel and we'll be able to get to them at the end of the session. And do use the chat function and use the all participants and attendees option so that we can all see what you want to contribute. Just a note that our sponsors have made the Fast Tracking Scotland Summit possible, but have not endorsed, supported or paid any of the speakers nor influenced the content of the sessions. So I'm delighted to hand over to this first session to Dr. Nicoletta Polacek, who will give us her reflections of the last 3 days of the conference. Thank you, Nicoletta.
Thank you. Thank you. And thank you, Nathan. But also, let me start by thanking all attendees, all our sponsors, all the important stakeholders who have facilitated the Fast Track Cities initiative. And from my governance perspective, as well as the perspective of a woman living with HIV, I really want to thank HIV Scotland for facilitating an incredible gathering. Incredible, because even verbalizing the notion that we aim collectively to reach zero new HIV transmission by 2030 sounds incredible. But this is not a sort of bad version of an Obama speech mantra, together we can. Indeed, all of us together, we can contribute to build and sustain a more compassionate Scotland. And before I summarize what we have learned, let me clarify the content within which lessons learned can be taken away. Let's not forget that Edinburgh, not long ago, was the AIDS capital of Europe. When AIDS came to us in the early 80s, we had no choice but to embrace it, as we were losing friends, lovers, family members, people we never met, and even people we didn't like. It was a kind of brilliant equalizer in a way, and such a splendid magnifier when it comes to highlight inequalities, discrimination, and power struggles. There was so much to do and so little time to waste. Stigma was not a word we would kind of use very easily, because it was the blatant discrimination and the unfair treatment of all those communities affected by AIDS that got us together. Different human beings with amazing stories to tell, but nowhere to go. In some instances, we didn't even have a place where we could die with dignity, let alone living without stigma. Geographical and linguistic differences, class inequalities, gender variations, they did not matter much. And at the same time, they made a huge, massive difference. A white, affluent man had, kind of still has, more power, more agency, a louder voice than most women living in communities affected by AIDS, even today. At the outset of the epidemic, we navigated stigma almost blindfolded. Our souls were crumbled and isolated as we inhabited magnificent sort of fishbowls. We were colorful in a sort of way. We were kind of stylish inhabitants of almost a parallel universe, a parallel world sprinkled with tears, suffering, and fear. And later we encountered joy at the acknowledgement that over the years, community decimated by the HIV virus could count on those who survived AIDS and the AIDS pandemic and could rebrand themselves as living with HIV. And I want to stress living with HIV. We were and are living longer, aging well, embracing the wonderful medical advances in science, which let most of us shout that an undetectable viral load means that we cannot transmit the HIV virus to others. Tackling discrimination against us became enshrined in most legislation worldwide, albeit several still very painful exceptions. Stigma, which was always lurking in the background, did not disappear though. It became our most precious accessory, carried as a sort of embarrassing outfit. That would be the equivalent of a Christmas jumper your old auntie got you at Christmas. Except the stigma is not a once a year I can put up with it experience. Stigma carries fear, and fear is often translated in a sense of low self-worth and self-esteem. Fear of rejection from others, from employers, from lovers, from friends, from acquaintances, even from neighbors, is much more subtle, even intellectually justified, and sometimes it can also be normalized. Discriminatory stereotypes and scripts that are associated with inequalities and assist to normalize discrimination in everyday life do still exist when it comes to HIV. And the language of stigma is complex. It can range from a communicated belief that is intended as explicit as how did you get HIV, to a verbal indignity, you deserve HIV because of your behavior. Whether unintentional or intentional, this language communicates hostility or insults. Through our own resilience, with the support of passionate, dedicated healthcare professionals, a visionary government, and a committed third sector, not only we have navigated through pain and tears, but we, as community living with HIV, but also as community affected by HIV, can be here today to be counted and to be heard. But I want to be clear about something. Today, not all communities are sitting at the table. And I can take a central stage here, not because I am a migrant woman living with HIV, but because I am a professional middle-aged terrible middle class and white woman. And this is what we need to commit ourselves to. We must learn to speak the language of those who are most disenfranchised in our society. This is an act of courage and humility, and not a tokenistic gesture. This is a must, and it has to happen now if we really mean what we have said during these 3 days, which is something that we would only dream about not long ago, that we can aim to new HIV transmission, zero preventable HIV-related death, and zero HIV-related stigma. There is no such a thing as hard-to-reach communities, I believe. What we have created instead is a system whereby we still silence excuse me, those perceived as less deserving in society. But we need to be willing to hear those different voices. And this is our shared collective responsibility. And when I say shared collective responsibility, I'm also talking to people living with HIV and to other communities affected by HIV. These are the voices of those branded as having chaotic lifestyles, having complex needs, those who are homeless, those who have no rights to remain in the country they call home. I have chosen Scotland to be my home, certainly not because of the weather, but because of the many possibilities that are on offer in Scotland to all of us. And all of us can play a part as citizens of Scotland, even before we embrace our role as civil servants, community advocates, health and social care practitioners. And I kind of need to apologize because I realize I'm doing that again. I'm too much like a bad version of an Obama speech. But what I'm trying to say is that when human rights are violated, when people's needs are not met, when individuals are discriminated, dissenting voices are not acknowledged, then it's much more difficult to put up with bad weather. What we have learned during this gathering is that perceived unachievable goals, such as preventing new HIV transmission, zero preventable HIV-related deaths, zero HIV-related stigma, are all achievable through meaningful involvement of people living with HIV, working in collective partnership. But involvement can be presented as the spokes of a wheel with no form of involvement identified superior to another. And I am quite mindful excuse me, that the nature of involvement is complex. And this model provides no limit to the involvement of people living with HIV. Such model attempts to dismantle hierarchies while tackling the experience of being invisible and being voiceless. Meaningful participation should also and need to be achieved through meaningful research, which is performed in collaboration in a way to enhance the competencies of the respective actors. By this, I mean research co-design as opposed to those living with HIV being consulted much later in the research process, which is the best case scenario, not just handed several questionnaires to fill. We learned during the time of the conference about the importance of testing and discussed the development of HIV Self-Test Scotland, with over 3,500 HIV tests ordered since its launch. This is also a testimony to the value and importance of collaboration within the third sector. During the conference, we learned that a significant number of people in Scotland who acquire HIV haven't even visited sexual health services before. And we discussed ways to respond to barriers to PrEP for African women in Scotland. I learned that only 26 women in Scotland were prescribed PrEP in the first 2.5 years. Discussions were held also about quality of life for people living with HIV. As people are getting older with HIV, they're also acquiring other comorbidities, really for the first time. This is the first generation of people living with HIV reaching old age, which is a milestone in itself. We identified during the conference and classified opportunities for stigma-free health and social care. This gathering also provided the opportunity of honest and transparent discussion about drug consumption rooms, which help prevent overdoses and bloodborne viruses among drug users, or the implication for sex workers of proposed prostitution law reform in Scotland, just to give you an example. Now, I'm going to leave you with a pledge, which might sound kind of naive in this simplicity. A more compassionate Scotland is possible, is achievable, as is and is very much desirable. And Fast Track City might seem a small drop of humanity, almost irrelevant in the great scheme of things, especially if you think this within the context of COVID, for instance. Except that here, now, we can address inequality, discrimination, and stigma. And if we put it like this, it does not seem such a small achievement. Let me renew my heartfelt thank you to all attendees again, sponsors and relevant stakeholders, and my biggest thank you to HIV Scotland, which is constantly making possible the impossible, making sure that stereotypes are challenged, barriers are not there for us, so that as citizens of Scotland, our human rights are not violated, and we don't have to ask permission to be here. Thank you again for attending this gathering. Remember, however, the many more citizens living with HIV in Scotland would have loved to be here, but they still cannot be here today. So if we don't act now, we might not even be able to hear from them, from their voices. It's for them with a voice that we don't want to acknowledge yet that we need to act now, not tomorrow. Thank you.
Thank you, Nicoletta, for that presentation. And we'll come to share some of our reflections as the panel on some of the things that you've said at the end. I'm now delighted to be introducing you to the Scottish Government Minister for Public Health, Joe Fitzpatrick, who is going to present now. Over to you, Joe.
Thank you, Nathan, and I'm really glad to be here with you all today virtually. It looks like you've had a fantastic summit, 18 sessions, 60 speakers, and I saw in the credits at the start there that there's been around 450 attendees. That's an absolutely amazing achievement. So well done to you, Nathan, and everyone else who's made that possible. So there's definitely been something for everyone throughout the sessions, and I'm really pleased to be able to say a few words as you reflect on what you've heard and look forward to what we can achieve. There's indeed much to reflect on, and there is more that we can and must do, but we've also come a long way. So it's worth, I think, just taking some time to acknowledge that. Scotland's made huge progress in detecting and treating HIV, and none of you need me to tell you that people with the virus are now living long, happy, healthy lives. But getting here has, of course, taken a lot of work. In particular, it's happened because of the sustained commitment of Scotland's sexual health services and third service sector organisations, working together to ensure that the people who need it have access to HIV specialist treatment and care. And securing that access to effective treatment means that most people living with HIV in Scotland no longer have detectable virus in their blood, and as we heard, therefore cannot pass HIV on to others. Scotland's also one of the first countries in the world to have an HIV pre-exposure prophylaxis service, offering free preventative medication to those deemed at highest risk of acquiring HIV. The programme's been successfully running for 3 years. Just over 4,000 people have benefited from it, having had PrEP prescribed at least once. But I note Nicoletta's point about the challenges that still remain around, particularly the prescribing of PrEP to women. In Scotland, we've the advantage of joined up interventions such as the HIV Fast Track Cities initiative, an initiative being delivered by integrated health services, local authorities and the third sector, along with researchers and primary care. This initiative will help us to build on the excellent partnership working around HIV testing, diagnosis and treatment in Scotland. An effective response to HIV in Scotland requires collaboration across organisational boundaries, and it's fantastic to see the work being taken forward in Aberdeen, Glasgow, Edinburgh and Dundee to help ensure a holistic approach is developed. So we have made fantastic progress, but our work, even in a normal year, would be far from over, and 2020 has been anything but a normal year. COVID-19 has put immense pressure on services, laboratories and public health generally, and other challenges persist. So there is the ongoing HIV outbreak in people who inject drugs, and it still takes longer than we would like for an HIV diagnosis after people become unwell. In the face of these unprecedented challenges, I'm more grateful than ever for the work clinicians, carers, counsellors and support workers have done to keep services going. Met with disruption, you've innovated with new ways to offer treatment, you've worked longer hours and gone above and beyond to ensure that support was there when people needed it. However, I know that despite all those efforts, some impacts cannot be addressed without a concerted effort on recovery. Just as an example, the testing capabilities of addictions and sexual health services have taken a significant hit, and they're only now beginning to recover. A great deal of hard work has, of course, continued to go into testing in Scotland. Particular thanks is due to NHS boards and also to third sector and community partners who've worked incredibly hard to find new ways to promote and provide testing, such as the fantastic collaboration between HIV Scotland and Waverley Care. But the overall impact of COVID on testing should not be underestimated. I know how important it is that people who are at risk of HIV get tested. That's why the Scottish Government committed in this year's programme for government to develop a recovery plan for sexual health and bloodborne virus services. This is a collaborative process. It can and must not be designed without the input of those who deliver and use the services that we need to rebuild. However, it's clear that a focus on a recovery and remobilisation must be to monitor HIV testing rates across all services. We must work collaboratively to improve testing rates to pre-COVID levels in all services engaging with those at risk. That will enable us to reduce new HIV transmissions and control and prevent HIV outbreaks in the future. More generally, the recovery plan will take stock of the impacts and challenges brought about by the pandemic. With the help of our partners, we'll identify and build on the innovations that kept services going this year, and we'll identify what we need to do to ensure those services continue in 2021 and beyond. As part of that commitment to recovery, I'm pleased that the Scottish Government has provided nearly £400,000 to develop a national online service for sexually transmitted infections and bloodborne viruses. That will allow people to request a test online and for home sampling. It will also enable the development of HIV databases to provide clinicians with comprehensive real-time data on HIV care and outcomes. The funding for the National Online Home Sampling Service means we will have a range of interlinked HIV testing interventions in Scotland to reach distinct populations. From the range of discussions across the 3 days of this summit and the passion that I see from you on a regular basis, it's clear that we can, as we must, go further in Scotland. The elimination of HIV transmission and stigma is a goal that we all share. Indeed, they go hand in hand. Without ending stigma, we cannot end transmission. The First Minister and I were both struck by some of the views on transmission in HIV Scotland's Public Attitudes Survey. It's clear that we must take every opportunity to share the facts about HIV. Otherwise, those persistent myths and misconceptions will continue to make life more difficult for those living with the virus. And the fear of that stigma will also continue to discourage people from being tested. In parallel with our work to change minds, we must continue to work towards zero transmission. That's why I announced on World AIDS Day that I've commissioned a proposal for how Scotland can become one of the first countries to eliminate HIV transmission by 2030. The proposal will provide advice on issues like target setting, outcomes and definitions, and building links across the system to support diagnosis and treatment. However, it will only be a first step. The hard work will begin after, as we try to make its recommendations a reality. This work will be taken forward alongside other measures to prevent transmission, including free condom provision, widening access to medication that prevents HIV infection, increasing testing capacity, and measures to prevent people sharing needles. And I'm proud to be able to talk about this work and the Scottish Government's role in it. However, I know that we will not make it happen alone, far from it. We will rely on HIV experts from the Scottish Health Protection Network, clinicians, academics, public health experts, the third sector, and perhaps most importantly, people living with HIV. Getting to zero by 2030 will not be easy. Of course, there will be challenges, but as I set out at the beginning of this speech, by working together, we have already demonstrated how much progress that we can make. This gives me every confidence that we'll meet these challenges too. So thank you so much for listening, and thank you all for your ongoing commitment and dedication. Thank you.
Thank you very much, Joe, for that really powerful speech. It's really great to hear from you and the Scottish Government about some of the work that's been happening. I'm sure people that have been watching are also keen to hear about. I'm now delighted to be handing over to Dr. Jose Zuniga, who is the President and Chief Executive of IAPAC, who are the main collaborating partner for the Fast Track Cities initiative. Over to you, Jose.
Thank you very much, Nathan. I'd like to express my gratitude to HIV Scotland for inviting me to the closing plenary of the Fast Track Scotland Summit. I'm also here to extend my congratulations to the cities of Aberdeen, Dundee, Edinburgh, and Glasgow for your incredible accomplishment in surpassing the 90-90-90 targets, which we were very pleased to announce on World AIDS Day this year. That is a remarkable achievement, and it speaks to leadership on a variety of levels, including community. So congratulations on that accomplishment. Of course, you joined the cities of Berlin, as well as Bristol and Liverpool in that distinction on World AIDS Day, and prior, the cities of Amsterdam, Brighton and Hove, Manchester, New York City, and of course, London, which has surpassed the 95-95-95 targets. I think it goes without saying that as we look at the global HIV epidemic, we still encounter the reality that we face 690,000 deaths annually. These are AIDS-related deaths, and that in many respects, that number represents an indictment on our global HIV response. So too does the fact that 12.6 million people living with HIV globally still lack access to antiretroviral therapy. So although we have seen a decrease in AIDS-related mortality, and although we have done a fairly good job of expanding the universe of people living with HIV who are accessing ART, we still have quite a bit to go. And it's one of the central reasons why we continue to push the commitments in the Paris Declaration on Fast Track Cities, with our firm belief that where we can recruit a critical mass of fast track cities in a country, we can have an impact on the national HIV epidemic. Of course, it goes without saying that just placing people on antiretroviral therapy is not enough. The third 90 calls for viral suppression, and that is largely to achieve the continuum to U equals U, or undetectable equals untransmittable, which is both a destigmatizing message for people living with HIV, but also an incredible incentive to create demand for HIV testing and treatment, and for folks to wish to remain virally suppressed. There's a great deal of support required from a variety of stakeholders to ensure that people living with HIV are able to maintain viral suppression. And there, of course, there is a pressing need for us to support the concept of teams of folks from the people living with HIV, clinical providers, community organizations, to support this ultimate goal of getting to zero new HIV infections and zero AIDS-related deaths, which requires U equals U. It also requires PrEP, and it requires a refocusing on primary HIV prevention. And so in 2021, the Fast Track Cities initiative will be focused in part on actioning the UNAIDS Global Prevention Coalition's 10-point action plan on scaling up primary prevention. That is an area that has suffered a great deal as a result of not enough attention to this important adjunct to the treatment agenda. As important, of course, we recognize that simply achieving and surpassing the 90-90-90 targets is not enough. This epidemic is more than just about numbers, more than just about percentages. It is about people at the end of the day. And in that regard, obviously, the need to eliminate stigma is front and center of our efforts, both globally and at urban level. Too many people living and affected by HIV and AIDS are experiencing stigma on a variety of levels including intersectional stigma related not just to HIV, but to race, gender, sexual orientation, and many other factors that come into play as you take a whole person approach to the Fast Track Cities work. So too, though, is a critical need to look beyond just HIV to overall quality of life. I've often said, what good is it to prolong a person's life, whether it's HIV, heart disease, any other chronic disease, if we don't tend to the holistic aspect of a person's life, from education, food security, housing security, employment opportunities. These are all critical elements that will allow us to succeed, and they are part of the Paris Declaration on Fast Track Cities with respect to social determinants of health. I'd also like to, of course, obviously speak to the importance of leaving no one behind. In that respect, the fact that we have 90-90-90 and other programmatic data are critical, but it needs to be used to advance an equity-based approach within each of the urban HIV responses that we are engaged in, whether it be in Scotland, in Tanzania, in India, or in the United States. Ultimately, achieving 90-90-90 at city level is not enough. We must achieve it across all key populations so that no one is left behind. And that will be equally true of the new UNAIDS targets for 2025, the 410s, the 695s, and the 90% requirement for integration of services, people-centered, context-specific services that get at the hardest to reach populations that represent the gap between 90-90-90 or 95-95-95 and getting to zero new HIV infections and zero AIDS-related deaths. And to that extent, we will be looking at these new UNAIDS targets that were released earlier this month to see how they are integrated into the Global Fast Track Cities initiative. Of course, I should also mention that the Paris Declaration on Fast Track Cities speaks to the elimination of HBV and HCV, the end to the tuberculosis epidemic, as well as addressing syndemic conditions, including mental health and substance use disorders, and of course, addressing the needs of an aging population of people living with HIV who are ultimately the output from the calculus for success of getting people onto antiretroviral therapy and virally suppressed. This is a cohort that has many needs, and they must be front and center as we address urban HIV epidemics. Because again, we can ill afford to leave anyone behind. I'd like to close by referring to a statement made by the first speaker that this felt like a family gathering. I wish to personally extend my invitation to HIV Scotland and all of the cities in Scotland to join us at the Fast Track Cities 2021 conference, which is tentatively scheduled to occur in September of next year in Lisbon, COVID-19 permitting. We dearly want to hear from you your best practices, and it's important for you to be able to speak to how you have maintained a continuity of HIV services in the midst of the COVID-19 pandemic. I am immensely proud of our Fast Track Cities network. As I speak to leaders in each of these cities, I hear about innovations, I hear about best practices that are being deployed to ensure that we do not see gaps across the HIV prevention and treatment continua, and that we address some of the stigma that has come out as a result of COVID-19, and that we address some of the fragilities that have been recognized or identified throughout the pandemic over the last several months. And so I will welcome you to Lisbon, hopefully. If not, of course, we'll go virtually as we are in this modern era. And of course, throughout the year, as we lead up to the Fast Track Cities 2021 conference, there are abundant opportunities for your cities to share best practices through our best practices repository. I invite you to do so as well. More information is available on our website, www.iapac.org. So thank you again to HIV Scotland. It is my honor to be here on a closing plenary, and I look forward to our discussion.
Thank you, Jose, for attending and speaking in this session. Thank you so much. I'm now going to hand over to Dr. Lina Sathya, who is the Medical Director for HIV at Gilead Sciences, who are one of our main sponsors today. Over to you, Lina.
Thanks so much, Nathan, and thank you very much to the organisers for giving me this opportunity. As Nathan said, I'm Lina Sathya. I'm the Medical Director for HIV at Gilead Sciences UK and Ireland. I started working as a clinician in HIV and sexual health almost 20 years ago. And back then, I wouldn't have believed it possible for HIV to be transformed into a manageable long-term condition with those who were diagnosed early and with access to effective antiretrovirals, achieving normal life expectancy. While the progress that has been made during that time has been phenomenal, we're now on the cusp of something equally transformative. Ending the transmission of HIV in Scotland is well within our grasp. The Scottish Government's commitment to zero new infections by 2030 is very welcome, and it's clear that we now need a cohesive action plan to provide a roadmap for Scotland getting to zero. Over the last 3 days, this important summit has highlighted some great examples of leadership and partnership across the Scottish HIV sector. The amazing launch of HIV Self-Test Scotland is testament to the strong collaboration between the third sector, NHS providers, health boards, and industry, enabling over 3,500 tests to be accessed within 9 months of the programme launch, and with over a quarter of those testing never having previously tested for HIV. The outputs from the Scottish Public Attitudes to HIV survey demonstrate that work to combat stigma and discrimination through amending misconceptions about HIV is of paramount importance. The work addressing the ongoing outbreak in people who inject drugs in Glasgow has to be commended, yet it's really clear that ongoing collaboration is needed to break down structural barriers to providing equitable healthcare for this most vulnerable of populations. These tailored approaches to meet the needs of the Scottish population are only possible with strong partnership across the sector, including people living with HIV, advocacy groups, clinicians, academics, government, and industry partners. We all have a role to play. Each partner has a unique set of skills and capabilities, and we can achieve so much more by pulling together skills and resources than by working alone. Only through coordinated collaboration across the sector can we make getting to zero a reality. Over the last year, COVID has catalysed change in HIV testing and care provision, and has highlighted health inequalities that we know have existed for people living with HIV and individuals at risk for some time. It's important to ensure that the changes in HIV prevention and care that have arisen during the COVID crisis reflect the current challenges and needs of the Scottish population. People living with HIV and key populations at risk need to be at the centre of decisions as to how the best of these changes in service provision should be optimised and expanded across Scotland to ensure that no one is left behind, as Jose was just discussing. So what does getting to zero encompass? By 2030, we can get to zero new transmissions of HIV. But it's also important to get to zero for the 6,000 people already living with HIV in Scotland. Zero stigma and discrimination, zero HIV-related deaths, zero difference in quality of life, and zero difference in long-term health outcomes. Gilead has been committed to improving the lives of people living with HIV for over 30 years, not only through the development of transformative medicines and a pipeline that is developing medicines from prevention through to cure, but also through our strong track record and commitment to partnering with local organisations and government bodies to enhance their work. For example, our HIV Age Positively campaign embraces the ethos of thinking and doing things differently, because the best solutions are rarely the most obvious ones, nor do they always come from the most obvious places. To provide fresh perspectives, we work with future thinkers, individuals who are known for groundbreaking work both inside and outside the HIV space, community members, charities, and HIV experts, to inspire new approaches to improve the lives of all people aging with HIV. We're collaborating on the Positive Voices Survey 2021, which will focus on exploring the experience of stigma in non-HIV healthcare settings, increasingly important as a generation of people living with HIV are ageing. Gilead's Outcome and Support Services team work with centres to explore local gaps in service provision and better enable full implementation of the BEVA standards of care. Through this programme, we've helped to improve care pathways for over 5,000 people living with HIV across many areas, including mental health, cardiovascular health, and care for women living with HIV. We're also helping to map out what digital optimisation of complex patient pathways could look like, and it's really clear that better integration across services, in particular with mental health and community services, is an opportunity that we need to make happen if we are to improve the quality of life for people living with HIV. As an organisation, Gilead have been supporting Fast Track City initiatives across the globe, including Scotland. Scotland's in a prime position to achieve our 2030 objectives, with a strong history of leadership in public health and an international reputation as a pioneer in BBVs. Scotland was the first country in the UK to make PrEP widely available, and the first to develop a public health action plan for hepatitis C, which has amazingly enabled micro-elimination of hep C in Tayside. National government must now drive and be accountable for reaching the Fast Track City goals through publishing a comprehensive national HIV action plan in 2021. This plan must be bold and ambitious, with clearly defined measurable outcomes, and it must be developed and implemented in partnership. It's essential that the HIV action plan be developed with the needs of people living with HIV and key populations at risk at the centre. As Nicoletta said earlier, they must have agency and a prioritised voice at the table. This is fundamental in order to address stigma, discrimination, and improve the quality of lives of thousands of Scottish people and their loved ones. We need to redouble efforts with initiatives that are tailored to the needs of the Scottish population. It's important that we don't just copy and paste. We need a plan that works for Scotland, that builds on our successes and addresses our unique challenges. We're on the cusp of doing something extraordinary, ending HIV in Scotland, but none of us will be able to achieve this alone, and we need to do it together. So the stage is set. We all have a part to play in achieving this ambitious but totally doable goal. By working together, Scotland can be one of the first countries in the world to get to zero. I'm absolutely honoured to have been given the opportunity to speak at this summit on behalf of Gilead. And I'd like to close with a brief clip highlighting some of the amazing work being done in Fast Track cities across the globe.
My wings are significant for the people who help lift me, because this is power. I can't do it on my own. Sometimes the wings are heavy due to the work.
Malcolm X once said, "When I is replaced with we, even illness becomes wellness." This is the tale of different communities in 6 different fast-track cities around the world and their efforts to end urban HIV epidemics by 2030.
Sasa nimekuwa na HIV for almost 27 years now. Na hii safari ni ngumu, si rahisi, ni ngumu sana.
This is a tale of struggle, of fear, of joy, and of hope. But the end is still being written. These are the tales of 6 cities, making progress and saving lives.
We have much more to do, but we are ready, we're willing, and able to end AIDS by 2030.
Thank you, Lena, for your presentation and that short clip. I've had the privilege of being in the Fast Track Cities conference in London last year when that was launched, the full film, and it is incredible to see some of the work that's happening in Fast Track Cities around the world. Before we open up to some questions, I'd just like to thank everyone who has made this summit such a success. I wanted to reflect on a few points that have come up, and whilst this is called our closing plenary, I do just want to stress that we have one more session on optimising PrEP services, so please do join us at 3:30 for that. I want to reflect on Scotland's unique response that the Minister discussed, the collaboration and partnership that is vital to our sexual health and HIV services in Scotland. Those services are vast. They're not just clinical services, it's the third sector, integrated services, housing, food, social security, social care, and much more. This conference has tried to reflect that: 3 days, 18 sessions, 60 speakers. Of those speakers, a third have lived experience of living with HIV or being PrEP users. A further third have come from our third sector services, and the following third coming from clinical and academic roles. This shows that in organising the conference, we've put at the forefront the important partnership of people, the third sector, and our health sector. It can no longer be acceptable to only have a seat at the table. We need to be well represented as equal partners. As our conference was going on, we saw the incredible scenes of the first COVID-19 vaccines being administered in Scotland and the UK. This is truly extraordinary progress, and it shows what can be done when we all pull together for the common good. And it's also worth reflecting that in the context of HIV, the British HIV Association have already published early guidance for people living with HIV when it comes to the COVID-19 vaccine. Over the last 3 days, we've had the opportunity to discuss lots of different areas that need to be a priority for us to deliver our shared goal. On Monday morning, we heard about the role that safer drug consumption facilities could have in dealing with the outbreak of HIV in the west of Scotland and shorten the health inequalities gap that has only been exacerbated by COVID-19. Our service redesign session gave me a lot to look forward to as HIV Scotland take forward the HIV Services Designing the Future programme. And I'm particularly interested to find out how we will solve the challenge of the desire to eliminate waiting rooms from sexual health and HIV services. We launched the results of the Public Attitudes to HIV report, which showed a mixed bag of results. Some of the challenges for public attitudes are that we haven't seen a public campaign about HIV since the early 90s. This particular challenge means that we have a lost generation of people who did not grow up during the early epidemic and who do not know enough about how to prevent HIV and treat people with dignity and respect, free from fear and stigma about that is caused by the myths and misconceptions of HIV. But that data gives us a lot to be grateful for too. 86% of Scottish people think that it is right that the government spend money on preventing long-term conditions like HIV. In the early 90s and 80s, as the epidemic was at its height, we were quick to incite fear in people to try and control the epidemic. But frankly, we've failed to tell people that HIV has changed. That fact that HIV has changed needs to be shouted from the rooftops. This point was reflected in today's stigma-free social care session, where we heard that it can't just be workforce development, but workforce development in the context of a public awareness campaign that is vital to create stigma-free spaces for people living with HIV. We hope that you can take a lot away from this conference, come away inspired by any of the sessions that you've taken part in, and know that we're all now responsible for taking forward the work that comes. From me and my team at HIV Scotland, thank you for being part of the conference and this movement. We still have a lot to do, but if I've taken anything from this, it's that we know there is an amazing group of people who work in the sector, people living with HIV, people who contribute to the sector. And it's those people that will help make our shared goal possible. Our shared goal is more than eliminating transmissions. It's about eliminating HIV-related deaths, about eliminating stigma and discrimination too. But whilst there's no cure, it's about ensuring that everyone living with HIV, and I really mean everyone, even as Nicoletta mentioned, the voices that we don't hear or the voices that we don't want to currently hear, everyone living with HIV can live long, healthy, happy lives with a good quality of life. Eliminating HIV transmissions cannot be the end goal. We can't get there and then let our good work go to waste. I know from the last 3 days and everyone that has been involved, panelists, attendees, sponsors, partners, that this ambitious goal are ambitious goals that we share and can be achieved. So I'm now going to welcome back our panel. Those of you who have still been able to stick with us, if you can switch your cameras on, it would be great to hear some reflections. So Lena, Jose and Nicoletta, I know that the ministers had to leave and we thank him for his time. Nicoletta, we've heard particularly from the minister about what the Scottish government have committed to over the next year or two. What reflections have you got from what you've heard in this session?
I think there is a kind of a stereotypical almost answer from or reaction rather from me is that okay, now that you are going to promise something, how are you going to involve people living with HIV? Are we going to be at the receiving end of decision making, or are we part of the process from the very beginning? And I want to be the part, you know, at the beginning of the story, not at the end when decisions are made. I understand politics enough, you know, that unless we're suitable for some discourses, we won't be invited. But I want to make sure that we are invited, because it's about us as well as, you know, public health.
Yeah. And Jose, in the context of global fast track cities, is there any, is there good practice that Scotland can learn? Obviously, we've used this summit not only to bring together Scotland cities, but promote Scotland worldwide. But is there anything in that point that Nicoletta's just made around the meaningful involvement of people living with HIV at the start of these discussions about how we eliminate new transmissions, stigma, discrimination, and deaths? Any good experiences that we can learn from in Scotland?
I believe that having people living with and affected by HIV/AIDS at the center of the response in any city or municipality is the most important best practice that I could highlight. The reality is, and it's been stated already, that too many times, and this was true certainly as we were launching the Fast Track Cities initiative back on World AIDS Day 2014, too many times lip service was paid to the idea of community engagement, with the idea that you could simply have one person living with HIV represent an entire community on a planning council or at a speaking engagement. You almost had a professional cohort of international speakers who were, you heard from them all the time, and they're all lovely people. We work with them in various fast track cities still. But this idea that the community is homogenous is ridiculous, and is something that we have tried very hard as an initiative, and our cities and municipalities have tried mightily to address by ensuring that we hear from all voices. Regrettably, over time, some communities were left out of the conversations. They were not represented at the table. But I'd like to state too that this is more than just being at the table. This is about facilitating community leadership. Ultimately, the response is owned by the community, not by the public health department, not by mayor's offices, not by government, not by the Fast Track Cities initiative, or even the donors who provide the valuable resources we need to do our work. So if the response belongs to the community, it needs to be led by the community, it needs to be for the community. Services need to be delivered at community level, and ultimately accountability, the accountability framework needs to be at community level as well to hold us all accountable for our actions or our lack thereof.
Thanks, Jose. From that, Nicoletta, I'm just wondering, one of the things that we want to get away from this session particularly is the what's next, as President Bartlett would have put it in The West Wing. What's next? And my favourite show, if on a side note, but what is next to ensure that vision that Jose and you've talked about, Nicoletta, making sure that everyone is part of that response. You know, we've tried to reflect that in this conference, very diverse range of speakers, participants, but how do we then make that go beyond a conference that takes place over Zoom and is reflected in the services, the design, the delivery of programs that are going to get us to where we want to be in the next 10 years?
If I can use an analogy, it's a bit like when you're imposing people to speak a language, and I'm a stereotypical example because English is not my first language, but it's my working language. So I had to learn the language in order for me to understand what other people were saying. So I think that important stakeholders, rather than asking communities to be accountable, important and powerful stakeholders should learn the language of communities rather than putting the onus on communities. And that's the way forward for me. So it would be very easy in a way to pretend that if we are sitting around the table and we have, as Jose said earlier, 20 representatives from different communities, we are embracing all languages, and I'm not speaking metaphorically, all needs of different communities. But it's those who are the power, those who have the power and those who are in power and are significant stakeholders that should learn the language rather than the other way around. And it's all very well, as I tried to say earlier, that I'm here speaking, but you know, I can be open about my status, but there are at least 100 people behind me who will never be able to be open about their status because of fear. And I'm just putting that in very simplistic terms, so it's much more complex. So that's where we need to work, but it's not up to communities, it's up to those who are working with communities. That's a big shift, I think.
Thanks, Nicoletta. Lena, I wanted to come to you as you know, as a funder, as an organisation that helps support community organisations, the length and breadth of Scotland and the UK, and really understand what role, and it's beyond funding, I know, but what is the true partnership that we can harness to take this work forward, that's beyond just the passing of money, which allows community organizations to operate? What's that true partnership that we could get from funders beyond, not just industry funders, but funders beyond that?
Yeah, I mean, it's definitely not just about funding. You know, Gilead are really committed to collaborating, and we've got strong collaborations across the UK and Ireland with third sector organisations, NHS Trust and government bodies. And, you know, we really want to do everything we can do to support. It's not just about chucking money at sponsoring a fantastic 3-day summit, but really collaborative working, so proper joint working. So examples of where we actually go into trusts and look at their patient pathways and talking to their service users, try and understand how they can optimise those is one thing. Helping investigators do ongoing research to better understand how we can optimise patient care. And really, I think importantly, we're all singing from the same hymn sheet that what needs to be aiming that optimal HIV care really moves away from surrogate markers like virological suppression. The outcomes really need to be redefining person-centred care, and what we should all be striving for is developing services and interactions with people living with HIV that are important to them. So I think we really need a shift in, for me, coming from an NHS service provider background, a shift in how services are commissioned, and they need to be defined by what's important to their service users. So bringing that person centricity into it, making sure that we listen to every patient's voice is something that we're a great proponent for, and yeah, very happy to partner with everyone across Scotland to help achieve that and make it a reality.
one final point to Nicoletta, and then I'm going to try and wrap this closing plenary up before our final session. Nicoletta, one of the things that I was really interested about that came out of the interactive workshop we did around HIV services and the redesign of those was people's dislike of waiting rooms. Now that doesn't have to be told to anyone, because going into a waiting room in any medical setting is not particularly pleasant experience. But what we heard in that workshop was, that perhaps the open, welcoming waiting rooms that sexual health services, HIV services have developed are actually the thing that could be stigmatizing in themselves for many of the communities that we want to access services. What do you think we need to do to make these services, and with or without waiting rooms, accessible for everyone in society?
Right. Okay. So I think that there are two ways in which I want to kind of try to address the question. One is that some of the work I've done academically is around the HIV clinic and the meaning of the HIV clinic, and whether it's important to have a protective space. I remember the old days when it was important at AIDS conferences that there was a PWH space specifically for us, and then it became almost like a ghetto, and it became quite insular, paradoxically, although there were reasons and rationale for that. So, and I'm very much in favor of, for a better word, branching out, because we have, especially those who are living longer with HIV, we have so many other health issues. So being sitting in a waiting room, metaphorically and realistically, is maybe the waiting room of another doctor, which not necessarily is an HIV consultant. I'm thinking about women dealing with issues around menopause. And again, I'm stereotypical in this conversation because I keep repeating the same story in many different settings, but it's quite important that we address this as an example. But I also think that when it comes to, but that is my personal opinion because of the way in which I access healthcare. And I want to highlight that it's only in relation to my own opinion, because I have a full-time job and I do so many other things. So I want something short and snap and available to me. But I also want a place which is very welcoming. Other people with similar experiences to me, but maybe with children, would want to have a different kind of waiting room. I'm not particularly bothered about the waiting room. I'm very bothered about appointments being on time. So again, healthcare and social care should be much more flexible, accommodating needs and expectations and desires of so many different people, which brings me back to what I keep saying and repeating. Unless we do research which is co-produced with people living with HIV, it's not just giving us questionnaires to fill, but we are part. I mean, I am an academic. I'm very capable to do research and set up a research project from beginning to end. And like me, I'm sure there are so many other people pretty capable of undertaking research rather than just filling questionnaires. So the questions are the questions we want to ask, as opposed to questions being asked to us. I hope I'm making sense.
Mm-hmm.
Yeah.
No, I think it's really interesting, and it came from a broad range of people that said the waiting rooms were one of the biggest problems of HIV and sexual health services. That brings us to the end of this this session, Fast Tracking Scotland to End the Epidemic. I'm not going to call it our closing plenary anymore, because I'd really encourage you all to attend our last session. Thank you to everyone, to our panel, to Jose, to Nicoletta, to Lena, especially to the Minister for Public Health, Joe Fitzpatrick, for speaking at this event. I know that there are many points that have been taken forward. what's next for Scotland in developing that elimination strategy. Is it a HIV action plan? Is it a wider sexual health and bloodborne virus strategy? Those conversations will come from this session, and I know that the minister and the government and everyone involved in these decisions will be hearing, especially loud and clear, Nicoletta, what you've said about making sure that people living with HIV are involved in these discussions, and I know the minister reflected that in his speech. But thanks to everyone that's attending this summit. We'll see you all in the next session, which is our final one. But thanks again, panel, for a wonderful session. I'm looking forward to seeing what comes from Scotland's fast track cities next. And a final message to Perth, Inverness and Stirling: where are you? Because we're ready and willing to welcome you into Scotland's fast track cities network. But thank you everyone for joining us, and we'll see you in the next session at 3:30. Thanks everyone.
Thank you. Thank you.
Thanks.
Thank you.